Usually I'll try and walk off to a nice quiet place and hide it, put in my mouthpiece, my little football mouthpiece, and I'll hide it. I'll go and walk off and have a seizure.
I served first in Korea, then moved on to Germany and deployed to Iraq, and back to Germany, and then Kuwait, 2004, and then continued second tour in Iraq, 2005, and got injured 2006. That brought me back home.
I'm pretty much a normal person. I have 2 wonderful children. I'm married to a wonderful woman. I served back in early 1985 through late 1987. The epilepsy was actually a reason for my leaving early. While I was serving my final 6 months, I was working CQ, and I had a tonic-clonic seizure at that time. And from there on, it's been an uphill battle.
I was wounded in Iraq and, by a VBIED car bomb. And I was comatose for a couple weeks, and during recovery, I was having some spills and some episodes, and I was told I'm gonna have this epilepsy.
I learned I was diagnosed with epilepsy very casually from a doctor looking at his clipboard and very coldly just stating I had new onset epilepsy and walking away. It wasn't until I came to the VA center that I received some more heartfelt care.
Some of the special needs in treating veterans with epilepsy are mostly related to social support services. After veterans have returned from conflict, simple things, or seemingly simple things like taking medications and dealing with general life issues that most of us take for granted can actually be very difficult.
Challenges was just accepting it. Accepting it was gonna be a part of life.
It's not just epilepsy. They have probably a combat injury, they may have post-traumatic stress, and they have epilepsy. So put yourself in the veteran's shoes. That is quite an array of issues that they have to deal with all at one time, and so they need our support more than the average epilepsy patient.
The Epilepsy Centers of Excellence is a national program funded through Congress and established in 2008 with the goal of providing epilepsy treatment for returning combat veterans who had suffered a traumatic brain injury.
In addition to standard clinical care for epilepsy, they also integrate educational offerings to both patients and providers, as well as research opportunities.
What was unique to me was just the extra kind caring that was given towards us. I think maybe some of that kind caring helped not trigger some seizures.
Since arriving, I've received CT scans, MRIs, PET scans. I've received sleep research studies, EEGs. The food sucks, but it's all right. No, the food's okay. Great chaplain services, and they have a psychologist on site. Everyone from those people sweeping the floors and locking the doors to those doctors really making the huge, profound, life-changing decisions, and it made a huge difference in my life.
A lot of people are surprised to learn that 1 in 100 people has epilepsy, and our veteran community is no exception. In fact, they are at sometimes higher risk of developing epilepsy because of the risks and challenges that they face in the work they do.
Many physicians, even neurologists and epileptologists, are unaware that the epilepsy centers have been created and are formed. I mean, we're a brand new program. We are unique in the United States in that we're an open access program. So any veteran, any family member, any doctor, be they in the VA or outside the VA, can refer a patient for care within the VA. And that's a unique situation in the United States.